Okay, I guess I'll start. Hi everyone. My name is Tom Garrity. I'm an exercise physiologist and laser user myself. I'll be hosting today's session. So, thank you everyone for joining us and welcome to our webinar. It's titled Dr. Rob Unfiltered, Integrating Laser Therapy into a Longevity Focused Practice. So, today's going to be a little bit different. We're going to be going behind the scenes. We're going to have a look at how laser therapy fits within a really well-structured clinical practice. This is Dr. Rob's practice. And he's going to go over how he uses laser technology along with his longevity principles. And he's going to give us a real practical, real world insight and also provide us some protocols as well. So this is going to be an open Q&A for you guys. You get some chance, we've already had some questions already, so we're going to be answering some of them, but along the way, please answer some of your burning questions you've got. It's going to give you guys some clear insights into how laser can benefit both your patients and your practice. Firstly, I'd just like to quickly mention that Rob is actually coming to Australia in May. He'll be here on the Gold Coast. This is where we're hosting our Integrative Practice Summit on the 23rd to the 24th of May. So for anyone who hasn't been to one of these, this is huge. If you're serious about learning advanced techniques, get some hands-on experience into what laser is all about, this is something you must attend. There's like a very big hands-on. Dr. Brett Jaros is also going to be presenting as well. It's great. Also, for anyone who's interested in the aesthetics side of things, that's on the 22nd of May as well. So look, guys, spots are filling up fast. We're also offering a special discount for you guys, for everyone who's watching today, 15% off. It's called Rob15. So that's only up for 2 weeks for those who have tuned in today. So that's not going to last long. So that's something to really think about joining, because this is one of the most advanced laser workshops you can do in Australia today. Firstly, guys, I'm just going to introduce Dr. Rob Silverman. We're so lucky to have him on today. For those who don't know Rob, he's a doctor of chiropractic care, a board-certified clinical nutritionist, internationally recognized leader in functional and integrative medicine. As the founder of Westchester Integrative Health Center in New York, he regularly integrates advanced nutritional science and innovative technologies such as laser therapy, really works on optimizing cellular health and recovery. He's a two-time best-selling author and globally recognized educator. Dr. Silverman has been implementing laser therapy in clinical practice for many years now, so a very long time, and he's here to show us how laser therapy can elevate clinical outcomes and transform patient care. So, Dr. Rob, over to you.
Thanks so much, Tom. I love that glowing, effusive introduction. I appreciate it so very much. I'm excited to be here. We should really nickname this webinar today AMA. Ask me anything. Just go for it. I'm here. This is my office. This is not my whole office. This is a part of my office. This is my rehab section of my office. So we put everything in here. I'm moving towards an open space. If I have one patient, I have closed rooms in the other areas. And I just wanted to show you that I do use the lasers. I've got two FX series. I've got an FX405. I have an FX635. Over on this side, I've got the base station, the Trident, which has an EVRL, an Accelerate, and what I like to call the master of the handhelds, the GVL. So again, feel free to ask me any question on laser, musculoskeletal, functional health, functional movement, brain. Let's go for it. Tom, I know you've got some questions that are burning to be answered.
All right, yeah, let's get into it. So Rob, the first question we have on the list is, what would you prioritize in a 20-minute appointment time, including lasers and treatment for any typical musculoskeletal issues, like the shoulder, the knee, the back?
That's a great question. I actually get that question or something like that 15 to 20 minutes every time I lecture. So believe it or not, I have some scribble here, and that scribble is something that I can read. I gave that idea some thought. The first thing that I like to do in a 20-minute session, mine are billed out at 15, but in a 20-minute session would be a quick history and some subjective, hey, how you doing? Because I always like to hear how the patient's doing. Did you do your homework? I'm big on that. I always give home exercises, suggestions for diet, supplements, etc. So that first minute is an introduction and get some subjective feedback. The next 2 minutes, I do some objective. I'll do a quick exam. I'm always evaluating and reevaluating. It's not a full-blown reevaluation, but it's moving the shoulder if it's a rotator cuff, bending, checking range of motion in the spinal area, especially the lower spine. So the first minute, subjective. 2 minutes, we're at 3 minutes now, objective. The bulk is obviously going to be 15 minutes, and that's going to be based around the treatment. I'm going to include an adjustment, soft tissue, electric stim possibly, instrument-assisted soft tissue mobilization, exercise rehab, taping, anything like that. And I will also obviously include on all my patients laser, whether I'm going to whisk it and move it and stand there and work through a particular protocol or a treatment protocol. And or also I can set it and forget it where I could press the button, walk away. I also have, moving out of the camera view, I've got, you guys can see this now? Yes. So I've got to stand there. So that takes 15 minutes. And then I'll do a locomotor lock-in. My locomotor lock-in is the upregulation. I am trying to press the save button in the cerebellum in the brain. Everybody through every treatment, if you use the laser for one thing, you would want to use the laser for a locomotor lock-in. And that's just lasering the cerebellum while somebody walks. And last but not least, again, I'm going to give them some home things like nutrition, home exercises, and that'll be a minute. So 1 minute of subjective, 2 minutes of objective, 15 minutes of treatment, 1 minute of rehab, locomotor lock-in, and 1 minute of goodbye. No dairy, no gluten. That happens to be big in America, and some exercise rehab, do planks instead of sit-ups, things of that nature. Let me know what you think about that. Why don't you populate that with Tom? Why don't you guys give me some feedback on that? That's my 20 minutes.
Yeah. No, I think that's great. Yeah, that's fitting. Some people struggle depending on your setup, but yeah, most chiros would run 15 to 20 minutes, so that's great. The other question is, Rob, which is probably a bit broad, but how would you run a great clinic? And maybe you could give your top three tips with that.
Well, it's funny you mention that. People always say, "What's a great clinic?" I'll give the business side. Let's put that out of the way. When I first started on my chiropractic venture, now like to consider myself a chiropractic physician with 27 years of experience. Somebody said to me, "There's three things to remember. Number one thing is treat every patient like you would want your mom to be treated. Makes it easy. Number two, um, keep your overhead low. Don't spend excessive amounts of money on paint in your office. Don't buy a tool unless you're going to use it. Make sure those tools like laser are FDA cleared, etc." And number three, find your niche and market it. So when I walk into a room, I want everybody to know that I'm the functional guy. Couple of tips to have a great practice. Number one, script pad. It's the most powerful thing I've ever seen a medical doctor use, a script pad. They write it down. It's a contract between you and the patient. Chiropractors, manual therapists have a tendency not to have a script pad. Tom, you're an exercise physiologist, rehab guy. I bet you use script, exercises and workouts for everybody, etc. So we need to do that
Yeah.
more on the musculoskeletal side with the script pad. And I'm a big believer in education. I think a video playing of the laser in the front, I'm happy to share mine. It's not one that I made, it's one that Arconia gave to me, really expresses and explains how laser makes an impact, an indelible mark on people's health lives. So you do those things, you're going to start with a great practice. And you know what? Just remember, I said it before, treat every patient like you would want your mom to be treated.
Right. The next question is, can you please explain how low-level laser therapy can be effective in managing spasticity?
Well, I have some personal feelings on spasticity because the reason I went into chiropractic is because of congenital torticollis. So that's why I have the asymmetry to my neck and asymmetry to my head carriage and forward head posture. So there's a spasticity in my SCM and even in my scalenes. Now, as I've advanced and I've hit a milestone decade of 60, I have some cervical dystonia, which is spastic torticollis where the muscles pull, they're pulling on the back. And I don't think I'd be able to go to work. I don't think I'd be able to do this with my head if it wasn't for laser therapy. So I laser myself every day. I do happen to laser my brain and my gut and my vagus nerve every day. That's just a standard. That's like brushing my teeth. But the extra coating is lasering the back of my neck, going through a protocol of muscle. And we don't have to get sexy with the frequencies. The two frequencies that I use the most when it comes to muscles, 4-9-33-60, nerve root, and 9-16-42-53 for muscle. So it works because it enables you to get ATP into the muscle, and I've seen a lot of muscle protein synthesis also occur from just using non-thermal low-level laser therapy. So spasticity, great choice. Can't get this fibric muscle, the muscle's dead. They now want to, just as an aside, they want to come in, they want to cut it, and they want a Botox me. We'll pass on that. Tom, do we have anybody populating anything? Guys, feel free. Ladies, please ask some
Um,
questions.
yeah, we're a few questions coming in, but we're going to go just down the list. Low level laser effects on neurorehabilitation. Pretty big.
Great question. Great question, because I believe that the idea of neuro and neurorehabilitation really may be the leading conversation piece when it comes to non-thermal low-level laser in the forefront. Again, I talked about it in the idea of laser motor lock-in. So locking it in, making sure that your body remembers the new treatment and the new movement and brain neurogenesis. But how does non-thermal low-level laser work for the brain? It improves cerebral circulation and brain oxygenation. It increases ATP at the mitochondrial level. It regulates mitochondrial homeostasis. It reduces neurodegeneration and inflammation. It stimulates neurogenesis, brain neurogenesis, BDNF, and neuroplasticity. And it's also shown to precipitously decrease the levels of amyloid beta in the brain. In addition, if you really were to shine a light on a brain that's injured, it would decrease edema, increase angiogenesis, increase lymphatic drainage, increase blood flow and cerebral oxygenation. As I said before, increase BDNF, close the synaptic cleft so glutamine or excess of glutamine wouldn't be released, decreasing the incidence of excitotoxicity. So if you want to talk brain, you want to talk functional neurology, Brett will be there. But if you want to talk brain functional neurology with me, there's nothing that I'd rather use than non-thermal low-level laser because it does not heat the brain. It imbues the brain to stimulate mitochondrial function.
Yeah, I think that's a huge one. That yeah. Another question here, Rob, is understanding patient flow and integration of services.
Yeah, so I think I read that question, if you will, or interpret it as, do you have to add time to your treatment because of the laser? Does it take the place of anything?
Yeah.
Laser works as a single standalone treatment protocol. So you could do the whole 15 to 20 minutes with laser. That's one way to look at it. The other way to look at it is it works in concert with all of your other treatment protocols, like acupuncture, like soft tissue mobilization, like adjustment, like electric stim, ultrasound, shockwave therapy, whatever makes you happy. So I think the flow is according to you. It has not lengthened my treatment time. If anything, it sped up my treatment time and actually sped up my treatment plan time as well. And patients are real happy about it. The laser is a great referral source because when people get better, they talk about you.
Nice. Next question, any particular techniques or tips for treatments of hand fracture, carpal tunnel, tennis elbow, de Quervain, tenosynovitis, anything something
Wow.
to,
So I got a question. Is that an occupational therapist? Is that a hand guru? Because that certainly sounds like it. Let's
yeah.
take them one at a time. I'm actually going for some occupational therapy now, and it's the first time I've ever done it, and I'm having a wonderful time. They're just so spot on, the therapists that I'm going to, the docs. They're doing a great job. My left arm, because of my dystonia, was 30% weaker, and in 3 weeks, of course, I'm lasering, but in 3 weeks of laser with their treatment, because I bring the laser in and I laser myself when I do all the hand work with them, my hands are now equal in strength. So I was just mentioning that one of the untapped vocations is hand therapy and occupational therapy. So we're talking about fractures. Now, I'm not going to promise you anything with a fracture. However, there's been studies that have shown that applying the laser has stimulated the healing of bone. And I have a great slide on that. I can share that with people, and I'll certainly share that. I'll make note of that to make sure I put that in my slide deck when I come out um, to Australia. As far as the frequencies, the frequency for fracture is 50. So my protocol is 4, comma 50, 4, comma 50. And I found it to be very, very advantageous to add laser to fractures. Some of the practitioners have told me they've lasered through the casts and still have had an outcome and an increased outcome. So don't be afraid. As long as it gets in, as long as one of those photons get in, it populates through the body, which is something we call biophotons, which we'll get to in a moment. So you talked about that. You talked about carpal tunnel. Is it carpal tunnel or is it pronator teres syndrome? Because if it's pronator teres syndrome, we're going to go up in here and we're going to laser there and we're going to pronate and supinate the arm. If it's true carpal tunnel, we're going to get the recurrent median nerve, open it up, and laser right in there. Also, I like to do a lot of neurodynamic tests to check if the median nerve is impinged up through the neck and the shoulder region. So that was carpal tunnel. I think we also talked about the Quervons and Finkelstein's test. So essentially, I mimic Finkelstein's test. Can everybody see me? And you know what? Let me get my handy dandy little laser, my nice little GVL, my good friend, and let me, sorry, everybody. So Duquerons, I'm going to do Finkelsteins and move it back and forth. And I'm going to rotate and move the laser. Now, what did I miss? I answered 3. I think there were 4 there.
Um,
Fracture, carpal tunnel, and Duquerons.
yeah, to go on. Yeah,
I
that
got them?
that was pretty much it. Yep,
Okay. How am
great.
I doing, my OT friend there? How are we doing? I found great results. You know, it's interesting that carpal tunnel was a game changer 20, 25 years ago in manual therapy practice. Don't see it a lot now. It's there, it hasn't gone away. But I mean, if you were just a carpal tunnel expert, you would be busy.
Yeah, definitely. The other question here, we talked about this earlier. Are there private health billing codes, private health funds that are commonly used in rehab setting? I could probably answer this for Australia, no, but Rob could probably elaborate on what happens in the US. Rob?
Sure, thank you. There are 3 rehab codes. We get remunerated for the rehab codes, but we're not necessarily getting remunerated for the laser because of the rehab code. So if I put somebody on a rocker or a wobble board, it's something called 97114 therapeutic exercise or 97112, pending on your interpretation. That would be neuromuscular retraining or neuromuscular reeducation. So yes, you could try that in laser. I have found laser to be a cash modification to one's practice. So it's sort of what we like to refer to around here in New York as a fee for service.
Yeah, in Australia, there are codes for laser surgery, but this involves, CO2 lasers and big sort of surgical procedures. We're not doing surgical procedures, so to speak. So most people just bill as a normal private health, whether they're seeing a chiro or physio, and integrate laser in that. So that's how it works in Australia.
Outstanding.
Yeah. What sort of
My
tests?
laser owners out there, I don't mean to interrupt you, Tom. My laser
That's right.
owners out there, what are you using? What codes, if at all, you're using? Give Tom some action. Keep him busy. I
Yeah,
want
if
to
you
see his
guys can
eyes
put
going back and forth.
Yeah, definitely. If someone can put in some codes that they've used, I know there's
We'll
some
talk about
electrical
it.
stimulation codes, but I'll keep a lookout in the comments and we'll get back to that.
By the
And
way, when I come to Australia, I promise I will do a carpal tunnel presentation. So that'll be one of the things that we're going to add in there. Since somebody asked about it, nobody asked for it here in America. I don't know why. I mean, it exists. It's still the same percentage of people. But again, I'll just add that to my notes.
yeah,
all demos hands-on.
Can't wait for that. What sort of tests would you do, Rob, for a progress exam to show improvement with the laser?
Another really endearing type of question. Well, I'm a big believer, and I like to video a lot of my patients. I like to video them when they walk. I like to video, especially since I do nutrition, how they look, as they lose their little belly, if you will. But the tests, I think the reproducible tests that we're talking about is everything is functionally oriented. I'll muscle test somebody. I'm not an AK guy, but I do believe in a muscle test because I think a muscle test is showing you an improvement and a baseline and a starting point. Range of motion, enormous on range of motion because the laser is shown to decrease pain and increase range of motion. It's got several FDA clearances for that. I do a lot of orthopedic tests, testing function and provocative movements. As I mentioned before, like a neurodynamic test where I like to make sure that the nerve can glide and slide through the body that doesn't get adhesed. I'm all about functional movement. Believe it or not, I watch people walk, I watch them sit, I watch them stand, I watch them bend. If they're healthier, I watch them exercise. You can see a lot. You can pick up an awful lot on just people sitting and standing and squatting, but you have to show them their baseline and their before and their after. Because if you think they're going to remember and give you credit for it, it just doesn't work that way. It's unfortunate. So get some sort of picture, get some sort of app, get some sort of video, get that baseline, go through any tests that I mentioned or any test that you like. But whatever you do, whatever test you started with, make sure you retest with the same test. Do not switch the tests because you'll lose some of the confidence in the patient.
That's great. Yeah, I'll just reiterate that, Rob, just quickly. Sorry. I had a patient last week that came in with shoulder pain, and I always use a goniotomer. So we did a test. He was about 120 degrees flexion. We did the laser treatment. His pain probably didn't decrease that much, maybe like by 1 point. But what did increase, like did really improve, was the range of motion. He went to like 165 degrees. So he improved 30, 40 degrees in one treatment. So you might be missing out on showing your patient the real benefits if you don't show that range of motion. So range of movement's huge.
Agreed. Remember, structure and function don't always parallel heal at the same rate. And people only see the function, they don't understand the structure. The laser is pleiotropic in that it affects both of them. So there'll be times where function is ahead of structure, but they're still not ready. For instance, their core might not be ready to handle a load, an overhead load, a squat load, even a goblet squat type of front load. So you have to understand that. And these tests will enable you to let and lead the patient along their health journey.
Rob, another one is, how do you see acupuncture working alongside with chiropractors in their treatment? Yes, alongside with laser therapy.
I don't do acupuncture in the state of New York. I'd have to go get a 1,500-hour license. It's just a little cumbersome for me. I think acupuncture is fabulous. What a great adjuvant to non-thermal low-level laser therapy. And you can do the acupuncture at the same time, and you can set and forget, point and shoot the laser. So I think that it may be the most synergistic combination. It would be fair to say that it's a superhero combo. I'm just not sure if it's the dynamic duo or not.
This is a bit of a well, someone's wrote, this topic pops up on social media a lot. Is this
Yeah.
bad?
No, I think that the fact that, and I assume they're referring to let's take it as they're referring to longevity and then they're referring to laser. So longevity. Now I think it's great because it creates an awareness. Yeah, there's a lot of jokers out there. There's a lot of bad actors. I hear you. But you know what? Somebody's got to set the world straight. So it gives you and me this opportunity to talk about something that people are interested in, that can help people. I mean, that's our job. We want to help people. I picked up and I left the OT yesterday and I thanked her very much. And I said, just remember, you're making it a mark on people's thing. And she lit up. Great thing. I mean, I know a couple of the longevity people have had some character problems. Okay. Um, we don't, we move on and people are searching. And, it's the extension, it's the growth of anti-aging. But remember what longevity is. It's not just lifespan, it's health span, avoiding chronic disease, and which I believe the white cloud above them both, the beautiful pearly white cloud, is vitality. So if people are coming in and questioning it, it's a great thing. We used to have a famous doctor. He's now into politics. His name was Dr. Oz. You may have heard of him. And a lot of people found him quite odious because he talked about a lot of supplements. It was the greatest thing in the world because he brought a consciousness and awareness to people who wouldn't know what alpha lipoic acid is. So it's a great thing. Now, laser, and I have a feeling I'm probably going to put a pin in this. I have a feeling there's going to be some question down the road that someone's going to ask about red light therapy.
Well, yeah, someone's already, this is the next question. They said, how do you explain
Oh,
the difference between the GVL? So, I mean, the GVL or EVL and LED or infrared light therapy in simple terms to our patients. So that's, yeah,
I
basically.
get that question every day. I get that question on a stage every weekend. I get that question a myriad of times on my social media channels. It's unbelievable. Red light therapy is not laser therapy. Red light therapy comes from a long wavelength, and the longer the wavelength, the more heat that it generates. Once you go past 720 nanometers in wavelengths, you go below 1.7 electron volts. Though that number below 1.7 is not enough to stimulate the complexes in the mitochondria and something called biophotons. So I don't want to tech everybody out and geek out on everybody. But the bottom line is the red light therapy is a long wavelength. This long wavelength needs more power. Therefore, it's heat producing. It has a positive effect to the tune of about 7 to 10%. When you look at the 65% in some FDA studies that the laser provides, there's no comparison. What a true laser like a Kona, like an EVRL and a GVL does is they stimulate the complexes at the mitochondrial level. So complex 1 and 2 are stimulated by the utilization of a 405 violet nanometer wavelength. Complex 3 is stimulated by a 520 green nanometer wavelength. And the red light, which they are referred to, the 635, not 820, not 770, not 1040, but 635 nanometer wavelength stimulates and closes complex 4. When you have stimulation of all four complexes, you have mitochondrial optimization, producing ATP, providing immune function, and also providing a signal through the body called a biophoton. That biophoton allows the body, which is interconnected, it's like a fiber optic network that goes through these things called microtubulars. And these microtubulars run around like railroad tracks in the body, and it communicates with the body, promoting a health signal. So, red light therapy, sort of like, sorry to say it like this, an advanced heating lamp, non-thermal low-level laser therapy working at a cell level. There is no comparison. It's a meal versus a couple of apple seeds.
Yeah, exactly. I mean, I think Aconia, you'd be able to correct me if I'm wrong. Aconia used LEDs as their placebos in their trials, didn't they?
Yeah,
So
they
there you go.
did.
Yeah.
And I'm happy you said it and I didn't because I didn't want them to think that the New Yorker was going to come and give them a hard time.
Yeah. So the next question,
Outstanding. Very
how do
common
we,
question.
yeah, how do we help children with ASD?
Yeah, autism is an unfortunate thing, and up to about a year ago, I had no autistic patients because I am married, but I have no children. Obviously, I'm a male, and for whatever reason, the decision makers didn't seek me out. I did a social media post as a reel. I've got a few moms that came in, and with the combination of nutrition and laser therapy really stimulated that, lit the fire for some people. So you ask about what you can do. Well, number one that we realize is that 90% of autism comes from the gut. That's a 2019 study. A follow-up study to that varied between 80 to 89.4%. So you've got to conceivably work the gut. So obviously you're going to make tremendous changes in food sensitivities, food adding, additives, emulsifiers, and food coloring. Also, you're going to laser the gut for 10 minutes. My master gut frequency is 4, 4, 9, 26. You're going to laser the gut. You're going to laser the vagus nerve. You're going to laser the brain. You mix that with all those other type of nutritional changes, the child's behavior will change in many instances. And I never thought two things. I never thought when I graduated chiropractic school that I'd be treating the conditions that I treat today. And I never willfully thought that I'd be treating autism in children in that manner.
Hmm.
So
Interesting.
what is the root cause? I think the root cause or root causes is gut dysbiosis, chemicals, environment. We have a vastly different environment that you do in Australia and New Zealand, and our environment is compromised. And unfortunately, because of this compromise of our environment and these excess chemicals that we're all exposed to, we're having a rampant growth in neurodegenerative disease.
Hmm. We just had this was the hand therapy question earlier. They just said, thank you for your reply with that. Just adding another piece to the puzzle. Interested to hear your tips on nutrition and longevity tips for clients, whether it's for muscle recovery, neurological recovery, stress and pain relief. This person's new to laser, so they're just trying to find information about all the wavelengths and everything like that.
So let's talk about the different wavelengths. I've actually got them up over here because it's always a normal question. So each wavelength has distinct properties. When you mix the wavelengths, you don't cancel them out. You actually add to them. So you stack them, if you will. So let's look. And by the way, a major concept, the lower you are, the lower the wavelength, the larger amount of photonic energy. I'll say that again. The lower the wavelength, the more energy. So 635, good wavelength. 520, more energy. 405, the most energy. That's why we've coined the GVL, the green and the violet laser, the most energetic handheld laser in the world or on the market. So let's take a look at some of the properties, the health promoting properties of the different lasers. Let's start with the 635. Let's go from the highest one that we use, the red wavelength at 635 and down. It allows for mitochondrial activity. It closes the complex at mitochondria complex number 4. It has prolific activity. It produces interleukin 10, and this is huge. Interleukin 10 is one of the only anti-inflammatory interleukins, and the production of interleukin 10 conversely decreases the production of NF-kappa B and TNF alpha alpha, which also decreases interleukin 6, interleukin 8, and interleukin 1 beta. So that red light is very anti-inflammatory. It allows for Treg support and cell proliferation. Let's go to the green light, which just happens to be my favorite. It's my favorite because when I see people come in, there's some new data out, and Harvard University has spoken about the green 520 nanometer laser as the choice wavelength for headaches. That's both regular headaches and migraine headaches. Also, the green light is a great add to IVD degeneration. You know what? Tom and I were talking about that before. We don't talk enough about lower back in these conversations because everybody's got a lower back problem. 8 out of 10 Americans at some point have a lower back. Maybe we'll pin that for now and get to it a little bit later. It's the biggest stimulation, the green light, of stem cells. It facilitates nerve regeneration. So that carpal tunnel, you would want a GVL. It stimulates osteoblastic differentiation. It's fabulous for autoimmune conditions, so it improves immune function. It shows improvements in fibromyalgia, which is an autoimmune condition, damage to the dorsal root ganglion. It reduces oxidative stress. And to reiterate, it reduces inflammation and the IVD disc degeneration. Lastly, the 405 nanometer light. Again, if you're a soft tissue guy, You want to be able to utilize the violet light because the violet light stimulates the parasympathetic nervous system. Therefore, any kind of fascial injury, any kind of sympathetic injury, you want to use the violet light to offset the increase in sympathetics. It provides a reduction of apoptotic cells. It improves breakdown of scar tissue, antimicrobial, stimulates VEGF, and you cannot stimulate the vagus nerve without the utilization of the violet light. So the three of them together is the way to go. You want three wavelengths because you get the full array and you get full mitochondrial optimization. Do we have any questions on that? Because those are huge takeaways. This is really where the Aconia laser hangs their hat on. It's their wavelength. It's the fact that they're true lasers. They have what we call collimation. They're coherent. So, Tom, did I ever tell you what a coherent and incoherent is? A red light is incoherent, a laser is coherent. What do I mean? You're going to take me out to one of your watering holes, and the guy next to us, he's a drunk. He cannot communicate with us. Our cells do not understand him. I'm going to turn around and I'm going to say to a well-bred New Yorker, I'm going to say, Tom, we have a New Yorker here, and he's going to articulate in a mellifluous manner, and we're going to understand him, and our cells are going to be able to absorb him. That's the difference between coherent and incoherent.
Yeah. I think that this probably leads on to a question that's just come on about trying to, when you look at lasers, whether it's an LED, whether it's coherent, uncoherent, and maybe you can sort of expand on how to test that. Because someone's also said here, can you confirm that the Advant laser is LED? Does it work based on heating tissue? I'm not too sure if you're familiar with the Avant laser system.
Yvonne, I hate to talk about anybody else's product because I know that the world is based on contrast leads to differentiation and understanding. And I don't want to speak incorrectly. My understanding, it is part laser and part LED, but I don't have an Avant. It is in my area. I'm the guy who doesn't sweat what everybody else has. I only worry about what I do. So I don't know if that's the answer that you were looking for.
Yeah,
However, my answer to anybody is don't ask me about a laser, please, unless they have an FDA clearance.
yeah,
Because without an FDA clearance, I wouldn't want to go into a court of law and utilize a device on a patient. So that would be my
yeah,
upscale answer.
yeah. Which, yeah, I can concur that Avant don't have an FDA clearance for low level laser. It's high powered laser.
There
Um,
we go.
yeah. So and because it's high powered laser, they've had to uncollimate the beam as because otherwise it'll ablate the tissue. So a lot of laser companies do that. They'll have to uncollimate it because even if you had a focused beam like a cornea's on the skin at a high powered, you're going to really burn the tissue, which is quite dangerous. Um, what's the best way, Rob, to treat uh, Hashimoto's?
Oh, Hashimoto's hypothyroidism. I had a podcast guest who's worked at the Cleveland Clinic, and I got a lot of great insights to Hashimoto's in general. So first, when you talk about thyroid, thyroid is the most sensitive gland in the body. That's number one. 75% of my thyroid patients have a gut issue. So there is without question a gut to thyroid axis. So we're going to talk about how laser helps with that. There's also, believe it or not, a mitochondrial to thyroid axis. There's a mitochondrial to gut axis. So we have this Bermuda's triangle when things aren't working well. And when they function well, we have a trifecta of health. So understand that the thyroid is adversely affected by gut, dysbiosis, leaky gut, and the like, and is also positively or adversely affected by mitochondrial function. Now, we all know that most people have mitochondrial dysfunction. I think that one of the best outcomes from the utilization of laser will be to laser the thyroid. I have a study right here that talks about there was a 47% reduction of a drug during a 9-month follow-up period. So almost 50% of the people gave up using a thyroid drug just from getting exposure to non-thermal low-level laser over a duration of time. Uh, Some conclusions and some other lasers studies. Non-thermal low-level laser could be a promising therapeutic approach for the treatment of autoimmune thyroiditis. The thyroid and the mitochondria, basically T3 regulates mitochondrial function. So the T3 and T4 communicate with the mitochondria, and it's a bidirectional relationship between the thyroid and the gut axis. Gut microbiota modulates T4 to T3 conversion. Thyroid hormones impact gut motility and barrier integrity, and also the absorption of essential micronutrients. Everybody wants the protocol. Here it is. I like my skin setting of 5, 20, 35, 112 for 5 minutes. My mitochondrial setting of 4, 9, 16, 32. That skin setting should be a thyroid setting. So let me try that again. I'm going to laser the thyroid of 5, 20, 35, 112, 5 minutes. I'm then going to laser the thyroid again on the mitochondrial setting 4, 9, 16, 32. And then I'm going to do my master gut setting for 3 minutes, 4, 4, 9, 26. So I'm going to laser the thyroid. I'm going to laser the thyroid a second time on a mitochondrial setting. And I'm going to laser the gut to finish it off. So 5 minutes here, 3 minutes again in another setting, and 3 minutes here. An 11-minute treatment protocol. Does anybody have any questions on that?
Just looking through, there's no specific questions on that. I think you answered that very well. Do you have any, Rob, do you have any packaged treatments so that patients don't expect a miracle in one session? Do you
We
package
sell
it?
packages. Yeah, I'm sorry, Tom. We sell packages, 10 visits. Because even if it's a 6 to 8 visit treatment plan, they'll still want to have some extra visits to come in on the maintenance kind of program, on a longevity plan, etc. Sometimes people need more visits, but 10 is a great number because it makes it for an easy number that they all know. You could do an 8 treatment plan, you could do a 12 treatment plan, you could do a 24 treatment plan, depending on the type of conditions and the demographics that you will practice in.
One question that's sort of related into that is how would you integrate laser as a very specific part of your practice if you have a low income area with high comorbidities? So, for affordability for that demographic.
Yeah, I mean I feel your pain. I can understand that. If the people don't have money, it's hard. There you have a lot of options. Option number one is you can see more new people and you can pay the laser back that way. So there's a story that I tell. I have a good friend of mine, and he's in a rural section of Ohio. He's a fabulous chiropractor. His wife is a very well-to-do lawyer. They live in the area, but they're the first house over the rich line into the rural area. And I asked him once in front of everybody, it must have been 100 people. I said to him, "How much do you charge per visit for laser?" And he said nothing, which wasn't what I expected. But what he said afterward was gold. He basically said that he lives with the people, he goes to church with the people, he shops with the people, school and the like. And essentially, he doesn't charge them anymore, but he gets 30% more volume because everybody chooses him because of the laser. There's no extra overhead to see those patients. So all that extra money, he's able to pay the laser back and have some for himself for more training and also help more people in his local area. So you may not charge, you just may see more people and they may get better quicker and you'll cover your expense that way.
Someone's just put a question in. This is related to fat loss, so maybe you can expand on it with your expertise on that. But someone said, what testing and what supplements do you suggest for fat loss with the Zerona?
Great question. So I use an in-body. You probably can't see because it's in the corner right there. And that in-body gives me body fat, gives me your overall body fat. It gives me fat per area, arms, trunk, legs, and upper body. It also gives me visceral fat, which is a tremendously indicative indicator. an amplifier of inflammation in the body. It amplifies inflammation so much, visceral fat, because it's fat over the viscera. It communicates with the brain and actually stimulates the opening of the blood-brain barrier and the ultimate demise of the blood-brain barrier. So that's the number one test that I use. Now, I can take blood tests. The blood test would be some inflammatory panels like C-reactive protein, HS-C-reactive protein. Now, incidentally, on a Zerona, a Z6. We're not talking now the VZ8 or we're talking the Emerald, which are flagships, but a more pronounced flagship than the Z6. The Z6, when utilized in the abdomen area, showed a tremendous decrease in cholesterol. I mean, in a 2 week period, it was like 75% of your LDL, triglycerides, and total cholesterol went down. In addition, if you were to lie flat in a prone position and just with the red light, not the other lights, which are much more potent for outcome, there was a 27.7% decrease after one 15-minute treatment in blood glucose and 7.7% decrease in insulin. So, your basic blood sugar markers, hemoglobin A1C are another great choice. So those markers with an in-body, which is a great investment, with your body contour lasers, it's a home run.
Yeah.
If I'm allowed to use home run with people in Australia and New Zealand.
Oh, definitely. That's fine.
It's a
Um,
it's a it's a score.
yeah, yeah. How are the frequencies determined for different conditions? This is an interesting question.
They're very variable. You will see five different speakers use probably five different sets of frequencies. However, the original frequency 75 years ago came from Royal Rife. I don't really adhere to those frequencies now. There's nothing wrong with them. I just think things evolve. I always use the example, imagine seeing a phone 75 years ago. My dad still remembers. He would pick it up and he would pull it down and he would have to ask for the operator and then he would put a nickel in and make a call. Now I've got the room. We have the smartphones that are 10, those have evolved. So where do we get them from? There's been some trial and error and there's been some studies done. So for instance, we're really exact on the one in the gut because I did a lot of studies on that. So that's one, it's again 4, 4, 9, 26. Vagus nerve is 10, 10, 10, 10. And the brain wavelengths, I have a whole bunch of slides that I'm going to share with everybody when we see you in Australia, how we pick the more common frequencies, which are 1, 5, 10, 20, 20 for Parkinson's, 40 for Alzheimer's and Parkinson's, 60 and 80. So in that range, and you could almost take 80 out of it. So 1, 5, 10, 13 for cerebellum, 20 and 40 and 60. So you have about 7 different frequencies. So if you have an FX405, you could put them in, you have up to 8 frequencies, you're covering the brain. I will say this, it's the wavelength, which is the main driver for effectiveness. That's 85% of the effectiveness. The other, I'll give it 10%, is the frequency. You will not hurt somebody with the wrong frequency. You can hurt somebody with the wrong wavelength.
Um, we've got a question here. Would you use laser on a patient who has just had brain surgery post-tumor?
I'm pausing because is it a cancer tumor? So I'll answer the question as currently constituted. I would get the laser on them because wound healing will be expedited with the utilization of laser.
Yeah. Um, one more one here, just on sort of Achilles tendinopathy and tendonitis success rate. There's also tennis elbow in there as well. Um,
Right, I think the tennis elbow we missed. So Achilles tendonitis, tendinopathy. As everybody knows who asks the question is sitting in on the webinar now, the least amount of blood flow to any part of the body is the Achilles tendon. So it may take a little bit of time. However, in that having treated a lot of Achilles injuries prior, and it took a little bit more than a little time, the laser will expedite your outcome. It does, so everybody knows, the aconial lasers have FDA clearances for plantar fasciitis. So that's plantar fasciitis, that's plantar aponeurosis, that's Baxter's neuropathy, the inferior calcaneal nerve.
No.
So that
Um,
was Achilles tendonitis, tennis elbow.
yeah,
I
that's
think I
it.
think we missed that one last time.
Yeah.
Um, I have found that a very effective means to speed up the outcome with tennis elbow is, of course, utilizing laser. A laser and exercise at the same time, really good choice. So I'm a big proponent on the idea of Simon says it's simple as one, two, three. You'll definitely see me do this in Australia. Well, number one is point and shoot or whisk. This is a whisk where you whisk it over. A point and shoot is just holding it in one spot. So that's one. That's step one. Step two is passively move the limb or passively move the area. One, you want to passively move it to make sure it can be moved, because if you can't passively move it, you may want to shut back down and go for some diagnostics. Two, when you can passively move a limb or a body part, you now can engram the proper movement in the brain. Number three is actively have the patient move the arm while you laser. So number one, point and shoot, whisk it. Number two, passive movement. Number three, active movement. Always end with laser motor lock-in and laser the cerebellum. Even if you're a chiropractor who just decides that they want to rely on spinal manipulation, manual therapy, and the like, even if you just add the laser to the mix, you're really going to see the adjustment hold much better. Because as we all know, part of the central nervous system is the spine and the brain.
Okay. Yeah, excellent. Look, with the little bit of time we have left, about 10 minutes or so, um,
Mhm.
Rob, could you just walk us through a little bit of your setup, what you've got behind us? Because we're going to do a bit of
Yeah,
clinical walkthrough and maybe talk about the different lasers you have there and what your setup is in your clinic.
not a problem. Be happy to. So I've got the FX635 here. Let's start with this. The FX635 has three diodes. Each one of these diodes is a red wavelength of 635. So I have one, two, and three. The power for each one of these are 17.5 milliwatts. It's milliwatts, not watts. And I'm going to turn it on. See, hopefully you can see, I can't see this. The array, the scan. The FX635 is a scan. Let me see. Oh, great. So you can see that it scans. That's why we have a little bit more power in milliwatts to it so it can scan the area. And what I like about the scanning is on and off to the body, on and off. So your cells taking the photon, give it a break. Taking the photon, give it a break. So it really enables you to break physiological zones. This particular laser is a little different in that it's got four diodes. It scans just like this one. It has a red diode, a red diode, a red diode, and a violet diode. So this is the FX405. It has four diodes, and the violet diode has a little bit more power. It has 22 milliwatts. Now I will stack these lasers. So my invisible patient here, I'll laser their brain and I'll laser their gut at the same time. And of course, I don't want to keep referring to when I come, but when I come, you're going to see all demo hands-on. We're going to break up into groups. What you're going to see is me talk and me show the different demonstrations. I didn't realize I was the headless horseman for a while there. I use this. Sorry about that. So we'll go over here and we've got the base station. The base station, again, they call it Trident. It's three specific lasers. There's the accelerate. The accelerate is two red wavelengths, 635, FDA cleared and all that. We have the EVRL, Erconio violet red laser. So that would be the starting point if you wanted to do vagus nerve stimulation. And why wouldn't you want to do vagus nerve stimulation? Cranial nerve number 10, goes from the brainstem, the medulla oblongata, innervates everything down through the transverse colon. It's just been referred to as the great nerve. So it just innervates all these different things. It is the key communicator between the gut and the brain axis. It's your rest and digest nerve. It's your wine and dine nerve. If you want to have homeostasis, you will need to stimulate your vagus nerve. So you have homeostasis between your parasympathetic nervous system and your sympathetic nervous system. So that homeostasis is a great thing, which may ultimately lead to allostasis, which is the balance in your brain. And then as I get closer, you've got the GVL, my little heartthrob, green violet laser. So the green light is 520, I delineated before. And sorry about that there. One of the things that I like to do is stack the lasers. You guys will see that. So by me stacking these two lasers, I'm getting all three wavelengths, and it's easy to move. It's a pound each. So hopefully that was a little bit of a run through of the different lasers that I have here. In my other treatment room, I've got the body contour lasers. I have the Z6.
Excellent. That's great. Look, guys, if there's any other questions we haven't got to, we'll be sure to answer them all later.
Fire
Um,
away, Tom. Go ahead. Give me another one. I know we're at the end. I'm going to make you work OT.
yeah. Look, I think with questions, actually, there was one last one on severe neck pain. Maybe walk us through how would you set up your lasers would you use, the FX405 or just go straight with the GVL, EVL? How would you use severe neck pain?
Excellent question. So severe neck pain, cervical dystonia, congenital torticollis. I feel your pain, literally, figuratively. Um, if I have an option, I will always use the FX because the FX is statuesque. It's sort of gothic looking. And here's what I'll do. I'll do a stack with that. I'll take my GVL. Goes right in here. And now you're going to get a full array of violet, green, and red. So that would be what I would do on the neck. So if you had a choice of lasers. So my choices are FX, number one, and GVL is my handheld choice. Now, what I would do is, if I had a patient, I would definitely whisk the area of the neck. So that's what I do for me. I whisk my area. I do it with motion, passive, active, a little resistance, and again, laser the cerebellum. I thought you guys were going to challenge me more.
Um, Another one we could answer just to finish off is, could you please explain the impact of poor metabolic health on mental health?
Yeah, poor metabolic health, like metabolic syndrome, high blood sugar, and the like.
Yeah.
So two kinds of metabolic health that would really be a problem would be the sugar problem, the insulin problem. Alzheimer's has been called diabetes type 3. Also, the concept of poor metabolic health will be gut health. So many of your mental health issues come from your gut and your ecosystem and your bacteria or your lack of good bacteria. And we call that dysbiosis. So you would need 85% good bacteria not to be dysbiotic. If you're dysbiotic, you're probably going to have a lot of mental health issues. The number one mental health issue or symptom is anxiety. I think it's 19.1% of Americans have anxiety. 18.4% of Americans have depression. Got about 39% right there, anxiety, depression. Interestingly enough, that if you were to remove food sensitivities, the number one set of symptoms that would abate would be the mental health symptoms before gas and bloating and brain fog. You combine that with laser therapy and a change in food, lifestyle, include your laser as your device for lifestyle, hence it'd be longevity. I proclaim that the person who uses laser and adds lifestyle will be the practitioner of longevity for the future and now.
That was great. We might finish off on that, guys. I think that was a lot of questions. I just want to say thank you to everyone for joining us today. Look, we hope you found the discussion and the answers that Rob gave to low-level laser therapy as fascinating as I did. Just remember, guys, that this field of low-level laser therapy, it's really advancing rapidly. So, staying informed like this with the correct science is the key when providing, the best care for your patients. Also, I'd just like to extend a massive big thank you to Rob Silverman for sharing his expertise with us today. We greatly appreciate your time you've taken off today to educate and inspire us. So a massive thank you. And look, once again, guys, we are excited to announce that Rob is coming to Australia. It's going to be on the 22nd for the aesthetic side of things, and the 23rd and the 24th for our Integrative Practice Summit. Look, this is a massive one for anyone who wants that hands-on experience. We're going to be there for 2 days. We'll all be there. And if we answer any more questions there, this is a big must. And once again, that special, that 15% discount, it's available for you guys for the next 2 weeks. So please utilize that because that's huge. Also, if anyone's in Brisbane and they're looking for something more small scale, there is a free little workshop that I'll be hosting on the 24th of March. That's at the Kedron Wavell Services Club at 6 p.m. So for all this information, head over to the ReaCare website, reacare.com.au, go into the events page, and you'll see all our upcoming events, and you can register there. But look, we are going to receive you guys a certificate of attendance today as well via email. You also get a link to the recording, so you guys can replay that as much as you want. And please, for the sake of us providing education to all these health providers, a little survey at the end would be greatly appreciated. It helps us deliver more education in the future. And yeah, once again, enjoy the rest of your evening, and thank you, Rob, for that great webinar.
Look forward to seeing you in May. Just remember, take care of your body. It's the only place you have to live.
Awesome. Thanks, guys.